Una well done o. My name na Dr. Toyin. Today we go discuss wetin dem dey call sickle cell disease. But before we continue, just stop this video if you never subscribe to my channel. You go ask say how you go take subscribe. E get one button for bottom wey say subscribe. Make you just press am. You no go pay for this thing o, e dey free. The only thing be say when new video come, dem go let you know say new one don come. Una don come back, una well done o, welcome. So as I talk before, we go discuss sickle cell disease today. You know say June 19 na sickle cell disease day. Wetin be sickle cell disease? Na one condition when dem dey inherit, and I go explain to you how dem dey fit inherit this condition.
As you see for this picture, e dey show how many times for each belle you fit get this sickle cell disease. The picture show mama and papa wey get normal gene and gene wey not too good. Na im dem dey call carrier. So as the picture show, for each belle, 1 in 4 times the pikin no go get any problem. 2 in 4 times the pikin go get that gene wey no good and normal gene. Na im dem dey call heterozygous or carrier. But then 1 in 4 times for each belle, the gene no go good. Na im be say na sickle cell disease, and na im dem dey call homozygous.
So normally the red blood cell dey survive 120 days and e dey very small. But when person get sickle cell disease, the red blood cell go only last 16 to 20 days. And the red blood cell go come hard, come stiff. So because e no fit dey bend well, e go come together, come form ball. That ball go come block the blood vessel where blood dey flow. So na im dey cause all the problem when dem dey get for sickle cell disease. Sickle cell disease dey common among Black Africans, Black Caribbeans, e come dey some Indians and some Middle East people. Also some people for South and Central America get am too. Some people don talk say dem fit link am with where dem dey get malaria well, or from place where malaria been dey before. As I don talk before, when the red blood cell go come form ball, e go come cause problem. So these problems now, we go put am into 2 places. One place dem dey call am acute crisis, another place dem dey call am chronic problem. So for the acute crisis, e fit get something wey dem dey call acute pain. Here the person go just dey complain of pain everywhere. E no fit put im hand say na here the pain dey. Na im dem dey call acute pain. Another one dem dey call am acute abdomen. That one dem go just get pain for the belle. Sometimes the belle fit swell. For some of them sef, dem go come get constipation. Another one dem dey call am acute anemia. That one, the person face and body go just white somehow. You go just see say in a few days e go just white. Then the person go dey complain say im whole body dey pain am. Some people fit get fever sef. And then sometimes the belle go fit pain them if maybe the liver or the spleen get problem. Another thing dem dey call am acute osteomyelitis. You see, when the red blood cell dey block the vessel, then e go dey make some places of the bone make e dey die. That place when dey die, if infection come dey inside, na im dem dey call am acute osteomyelitis. Another one dem dey call am acute chest syndrome. For here the person go dey talk say e no go fit breathe well. E go dey cough, e go get fever, e go get pain for chest. This one dey very common. Another one when dey happen, especially if to say na man, dem dey call am acute priapism. For this one, dem go come get painful erection. When the thing don stay past 3 hours, dem need to see doctor kia that time, so that problem no go dey after that. Sometimes too, it fit affect the wetin dem dey call the central nervous system. Then the person fit get wetin dem dey call stroke, when be say part of im body go just weak. E get some infections when dem dey get this thing well, and those infections fit include things like pneumococcal infection, urinary tract infection, and osteomyelitis. E get some things when if these things come, you go fit get this crisis well, and those things include infection, dehydration, that na when you no dey drink enough water. Sometimes when you just get plenty stress, that one fit get the crisis make e come. Sometimes too, if you go place wey get high altitude, you fit get am. If the temperature cold well, you fit get crisis. If you get belle, you fit get crisis. If sometimes you dey wan do surgery sef, and then they can't give you that medicine to sleep, that one sef fit cause you make you get crisis. As I talk before, e get a second group of things wey fit happen wey I say na chronic problems. That one you fit get problem with your gallbladder, or e fit affect your eye, or you fit not dey, your memory not fit good, you not fit dey remember things well, or sometimes you go just get pain every time. Some people e dey affect their lungs. If you wan do test for this thing nko, you fit do blood test make you see am. For some places, dem fit check the small pikin when dem just born to see if dem get this thing. Sometimes na the pregnant women dem go come do test for to see whether dem get this thing. If you get this thing nko, how you go fit help yourself? See the most important thing, make you no even get am at all. You see, as I explain how you fit get am, if to say you not even just make that one happen from beginning, then all this one no go happen. But if to say you get am, some people don do wetin dem dey call stem cell transplantation, and for that one you go come use either the brother or the sister of the person make e give wetin dem dey call stem cell, when be say e go come replace the cell wey no good for body. E get different type of this sickle cell disease. Now when you get wetin dem dey call homozygous, na im be say na im bad well, but e get plenty different types. E get some wey dem dey call SC. Sometimes sef when you no get am full, when be say one parent fit get am, maybe another one no get am, na im be wetin dem dey call trait. The people when they get trait, they no dey sick well like that. Some people sef dem dey get am with wetin dem dey call thalassemia, but these ones na mostly those when dey Middle East na dem dey get this condition. I hope say you na enjoy this video. If you na enjoy am, abeg, if you never subscribe before, just touch that button now. As I talk before, you no go pay any money for am. Make you watch this video again, make you share am, so that everybody go know about this sickle cell. And until next time, make sure say make you smile, because na im good well. Una bye bye.